Good evening. Welcome to the April 13th meeting of the General Plan Community Advisory Committee. I will take care of roll call. If anybody arrives a little late, I will go ahead and note that. We'd like to introduce Steve Herpo. He's the new Park and Rec Commission alternate. So thank you, Steve, for joining us. Do you want to tell the group a little bit about yourself?
My name's Steve Herpo. I'm a retired San Bernardino City employee, and I am currently on the Park and Rec Commission in South San Francisco, and operate also as a CERT volunteer with the fire department, and now joining this group as well. I lived in South San Francisco for about 32 years, and I'm glad to be a part of this.
Great, welcome. We're excited to have you. And I know I've seen Steve at a lot of these meetings, so I'm sure he'll no trouble getting up to speed quickly. So thank you for joining. And let's see, I have public comment on the agenda next. If there's any member of the public that would like to make a comment, you can unmute yourself and go ahead and do that now. Okay, no public comment. The next item is the consent agenda, and that's the approval of the March 9th meeting minutes. Does anybody have any corrections or changes to the minutes?
I do.
Okay.
Lisa, I was present. You have me down as absent.
Well, I am sorry about that. I will make that correction. Thank you, Sam. There are no other changes. Would somebody like to make a motion to approve the minutes as corrected?
I'll make a motion to approve the minutes as corrected.
Thank you. Is there a second?
Second.
Oh, okay.
I think that was Pat.
Yes.
Thank you. We have a motion and a second. All those in favor say aye.
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 Any opposed? Great, motion passed. And now I think I'm going to turn it over to Eric. Eric, are you going to give us a little update on all those fun community outreach meetings we just went through?
Sure. Well, I'll do just a quick overview of where we are in the process, and then I'll just hand it over to my colleague, Diana Benitez, who will walk through the content for today, because we're going to really focus on social equity, environmental justice, and community health in South San Francisco. As many of you know, because most of you were at those meetings, we just wrapped up a series of 10 community conversations around both different topics in South San Francisco, topics of the general plan. So we talked about housing, parks and recreation. We talked a little bit about social equity. And we also held a couple of meetings specific to certain sub areas in the city that we had focused on last year during the alternatives process. And those were around downtown, Lindenville, and the east of 101 area. Our team is now still in the process of summarizing the results from those 10 meetings, and we're going to get that summary up and posted to the website as soon as we can. But that'll include both the conversations that we have at the meeting, but also we have a series of online surveys now with the policy frameworks that we presented in those community conversations that are up and still out for review. And so we're still taking comments on those. And at the end, if we haven't already done so, I'll drop a link in the chat so you guys can go to those community conversations pages and the resources there, as well as those online surveys. And I would just encourage you all to send those out to your colleagues, friends, coworkers, so we can get some more feedback on those different policy frameworks. And as I mentioned, one of those conversations was on social equity, environmental justice, and community health. And really, Diana led that conversation. She's going to lead that conversation again tonight with you all. And with that, I'll just go ahead and turn it over to Diana, and she can start the presentation, and then we'll do a good, robust discussion at the end.
Thank you, Eric. So as you mentioned, I'm going to go a bit over the health and environmental justice and social equity background, and then we're going to go over the policy framework. One thing I want everyone to keep in mind is that these are technically two different policy frameworks. And so we have quite a few slides to go through, and there's going to be a lot of information, but we'll make sure to pause if you have any questions and get all your feedback. And so I wanted to just start off with healthy communities. This is a framework that we're using in the general plan because we want to make sure to improve the quality of life for everyone in South San Francisco, but particularly for those that are currently experiencing the greatest inequities and unmet needs. So when we usually talk about health or an individual's health, you're usually thinking about things like eating well or staying active or seeing a doctor. All of those things influence your health. But something that we've also learned is that your environment also influences your health. So it's on things like your access to social and economic opportunities, the quality of education, the condition of your neighborhood, whether you have safe housing, whether you have access to parks, whether you live in a walkable neighborhood, whether you have access to healthy food and transportation options, and everything else that I have on this diagram with all of these hexagons. And so something that we've realized is that all of these conditions influence why some people are healthier than others and why where people live and work matter when it comes to community health. And that's why in the general plan, and we're specifically going to have an element that touches on health and environmental justice, we're going to be talking all of the policies coming from this healthy communities framework, but we're also going to be talking about a social equity lens. And so when we talk about social equity, and I believe last year, must have been about April, I did a presentation where we talked about equity, and I explained what the difference between equity and equality was. But this is a bit of a recap. So when we talk about equality, we're talking about everyone receiving that same thing or same resource or the same level of support, regardless of any factors. And so if you look at the diagram that I have to the right, you see everyone receiving the same size box, but you see that people come in varying heights. And so they have a gap when it comes to the support that they need. But when we talk about equity, we're talking about making sure that people have access to the same opportunities to thrive and succeed. And that's making sure and understanding that many different people have different starting points. So they come with varying heights and that they all need different levels of support. So they need different size boxes to make sure that they're able to thrive and succeed. Because at the end of the day, we want to make sure that South San Francisco is a place where socioeconomic and environmental factors that include things like race, income, education, or place, that those things can no longer be used to predict health, economic, or other well-being outcomes. And we want to emphasize this because we know that those factors that I just mentioned, they're not decided by an individual alone, but by policies and laws. And in some instances, those policies and laws have negatively impacted people in certain communities while positively helping others. And so that's why as we were developing these policy frameworks, and you'll see our goals and our policies, we were thinking about social equity, and we were also thinking about healthy communities. And to dive a little bit deeper into social equity and health, I want to give you 3 data examples that we've used in our existing conditions reports that we developed, I believe, in 2019, just to set up this information a bit more for you all. And so the first one I have is life expectancy, and this is for the county, and we're looking at it by race. And so we know that in San Mateo County, a Pacific Islander or African-American child is likely to live 9 to 10 years less than an Asian or a white child. Now that's a decade, that's a long time. And one of the things that we know is that different populations experience different stressors in their life. And so there's a lot of reasons why some people may live longer than others. But when we start to look at things across race, and thinking about that healthy communities framework that I mentioned earlier, we know that some people can have stressors that come in the form of pollution in their neighborhood that can lead to asthma or other respiratory illnesses. We also know that some folks can be displaced from their homes, and that can lead to housing instability. We also know that not having access to healthy food can also lead to malnutrition. And we also know that the stress of racism can impact one's ability to have access to resources. And as we've seen time and time again, it can also end their life. And so I wanted to start from a very big picture and something that's very, very much connected to health, just to lay that groundwork. And the second data set I wanted to touch on touches on the fact that the state has been thinking about this and the impact to communities based on like what's happening in their environment. And so in 2016, the state passed Senate Bill 1000, and that's also called the Environmental Justice Bill. And so this bill looks at reducing harmful pollutants and associated health risks in what they're calling disadvantaged communities. And they also work to promote equitable access to health-inducing benefits, and they want to make sure to promote transparency and public engagement. So any cities that are making updates to their general plan need to include this new element, which is why we're also including this new element. And the map that I have is showing areas with high pollution burden in pink, and then areas with low income in blue. And you'll notice that the downtown is colored in twice, in pink and in blue. And we know that downtown is where the majority of Latinos and low income people live in the city. And so the third and final data point that I do want to show you is another map. And it's also, you'll see some similarities. And so this map is housing displacement. I believe I also shared this with you all last year when we were talking about equity. And so this map, we looked at 3 different buckets considering vulnerable populations, vulnerable housing stock, and neighborhood characteristics and market pressure. And those buckets had a lot of indicators underneath them, and they included things like households with lower median incomes, majority renter households, buildings with expiring affordability restrictions, and rapid increases in rents or sales prices. Now, downtown is the most at risk with all 3 buckets highlighted. And then we have a few that have 1 to 2 buckets highlighted. And so Pine Hill, El Camino, and Sunshine Gardens all have 2 buckets highlighted, and Orange Park and Avalon have 1 each. And so as we start to think about where communities are being impacted and who is being impacted, I'm sure that some of you, as I was, and I know I went through this information quickly, but you may have seen your neighbors represented in the data, or family members, or friends, or even yourselves. And I want to emphasize once again that these are populations that are experiencing worse outcomes, and they've been impacted by policies that have negatively affected them. And so these populations include people of color, it includes children and older adults, low-income populations, people who are houseless, people who don't speak English very well, people who lack health insurance, those who live or work near fire or flooding-prone areas, renters, or populations with chronic and acute illnesses, and that includes asthma. And we know that these populations are impacted the most because they don't have the same access to resources that others do. And if they, for example, can't make rent, or if their house is flooded, they can become homeless or hospitalized, and it'll be a lot harder for them to get back up on their feet. And that's why, as we start to think about, or we started to think about the ways we were developing our goals and our policies and frameworks, we were keeping these populations in mind. And one of the other things that I also want to emphasize is that we started thinking, strategizing how we would address inequities via policies. And I think this is something that I also shared with you last year, that we have like a 3-step approach where we think about what policies or actions we can do that can be procedural, distributional, or structural. And so we start to think from a procedural perspective, how we increase engagement, how we make sure that this is a transparent, fair, and inclusive process. From a distributional standpoint, we want to make sure that we fairly distribute resources, benefits, and burdens, and that we prioritize resources for communities that experience the greatest inequities and unmet needs. And from a structural standpoint, we want to make a commitment to correct past harms and prevent future unintended consequences. And we also want to address those underlying structural and institutional systems that are the root causes of social and racial inequities. And so with that, that is the brief primer introduction to why health, environmental justice, and equity matter. And now I want to jump in to talking about the policy frameworks, but I see that we have a few questions. So let me just, oh no, there were no questions. Okay, just wanted to pause. Does anybody else have a question before we continue on?
Yeah, I did.
Yes.
On the life expectancy slide, it seemed, are there populations that are missing? Because if I'm reading the slide correctly, it's saying white, Asian, Latino, Pacific Islander, and African American populations all have a life expectancy lower than county-wide, which would indicate there's a population not shown here that is much higher, that is pulling that county-wide life expectancy up. You understand what I'm saying? It says it's showing that the county-wide life expectancy is 82.8, but every other population is lower than that. So that would indicate that there's a population out there that's not listed on this chart that's bringing up this county-wide life expectancy.
Yeah, I think I would say that it's probably other. This is a data set from Race Counts, from a nonprofit that I used to work for. And one of the things that we did as we were looking at data across the county is that we removed data from a statistical significance standpoint.
Okay.
And so looking at how we tried to connect them to what the census had, and I would say that other is one that's missing, and American Indian or Alaskan Native is also not included.
Yeah, but that would indicate then that there's a large population that self-identify as other, much more than white, Asian, Latino, or African American, Pacific Islander, for this to be high. It looked a little odd to me. So that's just one comment.
Yeah, actually, I agree with Nick. Statistically, that something's pulling above, something has to be above 82.8.
Yep.
And that means other must be bigger than the white population, Asian population, Latino population. So that looks weird.
It's not necessarily that it's the largest population, it's that they are living longer, but because of the statistical significance in terms of thinking about population sizes, they were removed. So it's not necessarily that they have the largest population, but that their life expectancy is longer. But if we're dealing with smaller populations, do you see where I'm coming from?
Yeah, but it seems as though, I had the same observation when looking at this slide. It seems like if that were the case, then the countywide would just be a straight average rather than a weighted average, which doesn't seem to make any sense. Anyway, probably not worth dwelling on, but something to double check, I think.
Yeah. And then the other comment I had is on the slide after this. I'm assuming the CalEnviro and the state median income, is that kind of a state level criteria? I'm just interested. California is a large state, so there are areas where the median income is going to be much lower than what you would expect in South San Francisco or in the Bay Area, and so it's interesting to compare that to the state median rather than like the San Francisco Bay Area. And then also for CalEnviro screen, I would just have a question about what data set they're pulling to. Are they using like EPA or CAR data or something for determining what the pollution burden of these different areas?
Yeah, so I can start with the median income. This is something that we use. There's a two-step process where we look at less than 80% of the state median income in comparison to the state. And then we also look at it in comparison to the county. And so we have two cross checks, and usually the county is slightly lower, but we make sure to include both of those. And then for CalEnviro screen, this is a data set that's statewide, and it's looking at census tracts, and they're looking at multiple data sets. So they're looking at things like drinking water contaminants that they're using the state's EPA to get at this data. They're looking at information like ozone, PM 2.5, diesel, traffic burden. They're looking at housing burden. So they're looking at like a lot of different like pollution stuff and then sensitive populations. And so this is something that the state has had going now for a number of years. And this is their 3.0 version. And actually, they just recently released a draft version of their 4.0, but it's not going to be finalized until June. And one of the things to keep in mind is that their CAL-Enviro the way the scoring works is that they have percentiles, and their the census tracts are being compared to other census tracts across the state. And so the way that we analyze it here is they talk about the top 25% of census tracts that are in the top 25%. So if they're between 75 to 100%, they're marked in the red, and they're immediately deemed a disadvantaged community. And I believe for South San Francisco, this is only 2 census tracts for the pink.
And just to add on to and take a step back from Diana's detailed response. So the state, through its environmental justice guidelines that they developed for the implementation of Senate Bill 1000, developed a methodology that communities follow in order to identify these disadvantaged communities. And then the spirit of SB 1000 is that you look at environmental justice and health issues across the community, but then you focus and think specifically about these most impacted communities. And so they've kind of created this set of data and this methodology to identify those, with local communities then being able to look at the data, think about whether it makes sense, and make adjustment to those what they call disadvantaged communities. I will say those census tracts identified in the top 25% of the state actually, in a way, can be helpful because there are different pots of money available through the state to help support things like affordable housing production, transit projects, urban greening in those most disadvantaged communities. So by identifying them and making sure we recognize that they're there, it also opens up the city for opportunities to look for competitive grants for projects in the city. It can be a way to help fund, you can fund projects in those particular areas.
Yeah. Okay, and with that, I want to talk a bit about the different things that we learned and that we heard through this process as we develop these policy frameworks. And this is through all of the community engagement that we've had in the last few years, all of the surveys, all of the meetings, all of our conversations with you all. And so we know that 2/3 of the population speaks a language other than English at home, that service and production jobs have been decreasing, that there's a large proportion of the population that aren't as physically active, that healthy food access is limited in many neighborhoods. And as we just discussed, we have disadvantaged communities identified, but we also know that there are existing opportunities to improve access to healthy food, healthcare, physical activity, as well as opportunities to preserve, protect, and build affordable housing and shelter. And then I got very excited with the icons. So these, I think, are the only 2 slides where I have a whole bunch of icons. But we also heard that there were concerns on the impacts of future growth and what that would do for noise, traffic, and pollution impacts. From a housing perspective, we heard that renters, teachers, and folks of color were being priced out of the city. We heard that housing was unaffordable, and it had led to a lot of families or a lot of people living together in a single household. We heard that there was an increase in Latinos, older adults, and people with disabilities who are homeless. From a community perspective, we heard that South San Francisco was very welcoming and diverse, but at the same time, we also heard that in some instances, the Latino community feels ignored, in some instances because they don't speak English as well, and so they feel that they can't communicate, or folks in downtown feeling like they haven't had access to services or resources. And then from a healthcare services perspective, there was a need for a mental health center for youth and young adults. And from amenities and services, people wanted to see more grocery stores and more community gardens. And in terms of where we wanted to be in the future, we had all of these 10 meetings, and some of the feedback that we got in relation to these two policy frameworks related to people wanting to see more aging in place policies. We have aging in place policies in our parks and transportation. And as you'll see, I think I have like 2 or 3 policies here that are related to aging in place, but people wanted to see more. They wanted to see the inclusion of diabetes or obesity as a performance indicator. They wanted to see different types of food pop-ups, and we had thought of these as farmers markets, but folks were like, they don't have to be farmers markets. People wanted to see more kids data on things like food insecurity or homelessness. There were eviction concerns, especially after the moratorium ended. People wanted to see parks in downtown. People wanted to see more transit access in single family neighborhoods. People wanted to see allowing of more ADUs, so more ADUs happening in the city. People wanted to make sure that affordable housing was actually affordable to current residents. And then there was something kind of a bigger picture where people wanted to have access to information, but in a lot of instances, it's coming from a lot of different places, city, county, and state, but people want to know where it is and for it to be in a language that they understand. So potentially thinking about how to create a hub or making sure that people were connected to the resources that are already available. And so the policy framework that I'm going to be diving into, this is an interim step. We're sharing initial ideas, general ideas for policy direction, and this isn't an exhaustive list of policies or measures, but they're ideas that we want you to review and to react to. And also to keep in mind that there will be additional policies and measures that will be included in the general plan. And as a reminder, these are 2 policy frameworks. So one on health and environmental justice, and then one on social equity. And so this framework structure, we have outcomes at a high level where we have statements describing where we want to be in 2040, and they're aspirational. And then we have goals that express community values and direction. And then we have different policies and measures that talk about how decision-making is being guided, and then the action, the partnership, or the program or the activity that's going to take place to carry out the policy. And we also have data connected to these. So we also, that we're going to use to measure progress, and then we have targets where we either say increase, decrease, or we have like a certain percentage or a certain number so that we want to be able to track change and see this happening. And so in terms of desired outcomes, we have, I believe, 7. We have 2 for equity and 5 for health and environmental justice. And so for equity, we have race no longer determining one's socioeconomic and health outcomes in South San Francisco, and that everyone has an opportunity to thrive. And then we also have South San Francisco applying an inclusive engagement process that allows everyone to take part in city decision-making that impacts their lives. And then from a health and EJ perspective, we have a high quality of life for residents of all ages, income levels, and abilities that increases life expectancy and reduces the disparity between racial groups. We have that all residents will have access to high quality preventive and health services. We have that all residents will breathe clean air. We have that all South San Francisco children have access to affordable child care and universal pre-K. And we have that residents have convenient access to opportunities in their neighborhoods to be physically active. And then we have related performance metrics. And so we have tracking of racial equity impact assessments and equity capacity building trainings that will be done. Thing for city staff, and I'll be diving into it later on when we go into policies. And then we also have a metric on engagement touches. So it's making sure that there's an increase in the different language speakers like Spanish, Mandarin, and Tagalog that you're reaching out to, tracking different races, tracking folks of different disabilities as well. And then from a health and EJ perspective, we have tracking life expectancy by race and ethnicity. So making sure that it's stable or increasing. Then also adult residents that seek preventive care. So we can see an increase in adults that are going to their primary care doctor and not seeing the doctor for the first time in the emergency room when folks have waited and things have gotten worse. And then another thing is tracking asthma-related emergency department visits, and so seeing a decrease in that rate. And then we also had children physical activity levels. So to see the decrease in the number of children who aren't meeting physical activity guidance at their schools. And now we can jump into the policy frameworks. And so just keep in mind, we're going to have a lot of slides that are going to have a lot of text, but I'm going to walk us through it and you'll have time to review it afterwards and also go online to take a look at these full policy memos that are about 6 to 8 pages. And so one of our first goals is being a leader by collaborating across departments and jurisdictions to incorporate equity considerations into policies and programs. And this includes things like joining GARE, which is the Government Alliance on Race and Equity, to build organizational capacity and implement equity tools. This can also include doing things like conducting capacity building training so that city staff can apply an equity lens in their day-to-day work. And that can include doing things like an equity impact analysis. So when public services is thinking about parks, police, or fire, that they're thinking about how these are equitably distributed throughout the community and like who is being impacted and what needs folks have. This also includes making sure that city staff and boards and commissions are reflective of the diversity. So when we're talking about race and ethnicity, we're talking about gender, language of spoken, and based on some of the feedback that we got at the community meeting, also ages in South San Francisco. And now if we jump into the next one, I'm going to be giving a few examples of emerging practices. And so you all have actually been taking part in an emerging practice. And I think maybe some of you are also involved in this, but there's the South San Francisco Commission on Racial and Social Equity. They've been going strong for a while now, and they're currently in phase 2, and they're preparing to get into phase 3. And I believe they have about 11 different strategies that touch on public safety, that touch on housing, that touch on health. And they're thinking about different policies and strategies that the city can undertake, and some of those will be included in the general plan. If we go into the next one, we also have another goal that talks about engaging all residents in decisions that impact their lives. And so that includes hiring staff who speak multiple languages. And like I said, that includes Spanish, Mandarin, and Tagalog. That means also providing multilingual interpretation and translation at community meetings. This can also mean convening the Community Advisory Committee to monitor the general plan, the implementation, and making sure that the CAC is representative of the community. This also includes things like promoting data transparency so that there's an open data portal with information on detailed city budgets, engagement demographics, and things like police use of force, so that you can hold the city accountable and make sure that the goals and policies that have been developed, that we're keeping up to it. Another goal is to be a leader in promoting healthy communities through collaboration, prevention, and education. And this includes to continue and develop new partnerships with San Mateo County agencies. There's a lot of existing partnerships with like public health organizations to make sure that behavioral health services and other programming is being given to everyone in the community, and so that folks have access to these services. There's opportunities to have innovative private and public partnerships so that you can provide medical, dental, mental, behavioral health services and pharmacies in different areas that can include downtown or in new residential areas like Lindenville and East of 101. We can also create a drop-in center for people without homes so they have access to look for housing and jobs. We could also provide food, computer access, restrooms, case managers, and housing rights advocacy, just to name a few. We also have another goal that touches on closing the gap of healthy food options for low-income residents in the city. And that can include things like working with developers to create a grocery store in downtown or east of 101. That can include promoting targeted efforts to expand farmers markets in South San Francisco. And that could include in downtown. This could also include encouraging edible landscapes, fruit trees, and community gardens in city parks or different public spaces so that there's more access to healthy food. And I do have an example of an emerging practice. In Oakland, they have worker co-ops for grocery stores. And these worker cooperatives are worker owned. And so they help to create dignified and stable jobs. They help, and the ones particularly in Oakland strive to provide local food from Black and brown farmers. And they make sure that they provide healthy, affordable food, because in some instances, the closest food shop that they have is a liquor store, and the food isn't as healthy or it's a little older. And these programs also help to build community assets and wealth, because these folks become worker owners and they're able to choose what they're investing in within their community. And I just wanted to give an example that Mandela Grocery, I think it's in West Oakland and it's been around for 12 years. And there's one in East Oakland, the Deep Grocery Co-op, that they're currently fundraising for this year, and they hope to have it open next year. So it's a different way of thinking about how to bring in or how to close that gap to food access. Another goal that we have is supporting safe housing and shelter. And so there are a few programs for people with homes, and there's a few programs for people without homes. So people with homes, that can include things like continuing to work with the San Mateo Fall Prevention Task Force to create safer homes for older adults. So that can include things like making sure that there's losing my train of thought. Sometimes I have days where the Spanish word appears, but not the English word, but I will describe it to you. So the guardrails, so that folks don't fall when they're in the shower, but also having policies to support if there are older adults that live on like above the first floor. So if they live on the fourth floor, helping them transition to a first floor to make it a little safer so they don't have to go through all of the stairs. And so thinking about those types of policies. This also includes things like expanding maintenance and abatement assistance programs for single homes, and that includes mobile homes, so that folks have support to make improvements and to have healthy homes. And now programs for people without homes, that can include things like providing mobile shower, bathroom, and needle exchange sites and facilities for people without homes. It could also include partnering with the local shelter to provide cots for a more emergency shelter situation. And then we have another goal on protecting vulnerable households from displacement. And that it can include things like developing an anti-displacement plan to halt displacement in the city. And it can include, or it can start with those displacement risk areas that we identified in an earlier map. And these, I will talk about that on the next slide. This also, something actually that we heard from a council member a few months back is including disability in the existing live to work preference policy to make sure that folks with disabilities have access to housing. We can work on providing foreclosure assistance to help homeowners at risk of foreclosure by being able to provide financial or counseling support. And then there's also an opportunity, which is the last point, to encourage resident-controlled limited equity ownership. So these are things like condominiums, cooperatives, or community land trusts, just to name a few. And an emerging practice that we have been seeing is a lot of jurisdictions have been doing anti-displacement plans. And so coming from an affordable housing perspective, folks usually talk about it in threes. So they talk about the production, how to incentivize the building of affordable housing. They talk about it in terms of how to protect and support tenants and homeowners. And they also talk about it from a preservation perspective, how to preserve the existing affordable housing. And so these anti-displacement plans tend to focus on the protection and support for current tenants and homeowners, but they acknowledge that in some instances, if they feel that there's going to be an increase in development, and it could include housing, and they're concerned that that may impact people, they develop policies beforehand to make sure that they protect and support these tenants and homeowners. And so there's a few plans. They all are called a little differently. There's a displacement avoidance plan in Fresno that was just released last year, the Anti-Displacement Action Plan in Portland, Oregon, and then the citywide residential anti-displacement strategy in San Jose, which has been ongoing because they have a large Google development. And so they're taking all of that into consideration. And so all of these plans take lots of different things into consideration, like they consider rent boards or having just cause evictions, including rental assistance, rent stabilization policies, and right of first refusal. And they also use data to track and make sure and decide when they have to enact some policies and if they have to be immediate. And I believe I have about 3 more goals and policies to go through. So another one focuses on reducing air pollution exposures near freeways and industrial uses. And so that includes doing things like identifying funding for air quality monitoring and reduction strategies in Lindenville, east of 101 in downtown. ARB, I believe, in terms of air monitoring, they don't have the instruments to track air quality, like in all of your neighborhoods. They only have them, I believe there's one near east of 101, but it may not even be directly in east of 101. And so it helps to get some more local data for tracking. And there can also be opportunities to create incentives for the different uses of production, distribution, and warehousing in Lindenville and east of 101 to reduce pollution through different things like greener trucks or energy efficient buildings, among other things. There's also opportunities to make sure that the truck routes are kept up to date and making sure that the exposure to sensitive land uses, that includes things like houses and daycare centers and schools and hospitals, that they're reduced, as well as managing truck idling in new residential neighborhoods. So there's some instances where sometimes trucks park, but they don't turn off their cars. And some of these large diesel trucks, they can stay on for a long period of time, and that can impact folks who are around the area. And there are also opportunities to make sure that new development, but also existing buildings that are near, like I said, production, distribution, and warehousing uses, as well as freeway and rail, to implement different mitigation measures to reduce indoor air pollution. And so that includes making sure that they have to have like air filtration or ventilation systems in place. There could also be different landscaping techniques that they could take into consideration. And in terms of an emerging practice, in Los Angeles, there's a program called Clean Up, Green Up that was passed in 2016 in relation to their green zone. In the southern part, well, actually it's central to southern part in Los Angeles, there's a history of a lot of older industrial and auto uses. And so the community came together with the city to help develop buffer zones of 500 feet between new or expanded auto-related uses and residences. And they required air filters in all new residential units within 1,000 feet. And they have a lot of policies in place to reduce that truck idling with the trucks near warehouses. And they also took into consideration a lot of policies for site planning, because when you think about where these industrial uses put their trash, there could be smells or there could be other things impacting. So taking that into consideration, where they're storing their materials, where the outdoor lighting is. I know I have a personal example. My family is from Los Angeles, and whenever I go home to visit, we have an industrial property right next door, and they shine their light directly into my window. So at night when I need to go to sleep, I have a process of like sealing my windows, because if not, I don't sleep, because they have that light on 24 hours a day, you know, or at night, they have it really shining really bright. And so this policy sets it up so it takes into consideration when you have residential uses nearby, you try to make it easier so that folks can live together and folks can get sleep, among other things. And they also have a program that focuses on small business support to improve their operations and their funding. And so they help them see how to improve things like having greener trucks or energy efficiency, and they help them see how some of these changes could help them in the long run to save money and also help to support the community and reduce different pollutants that folks are experiencing in the area. And that's the last one. So I know I went through a lot of them, but we wanted to take some time to hear your thoughts on the outcomes or on any of the performance indicators, which policy ideas you liked best, if there were things that you thought we were missing, and anything else that you would want to share with us. And I could go back to any of the slides. And Eric?
Yeah, just quickly, we had a couple of comments in the chat or questions in the chat while you were presenting, and I want to raise them up. And I'm going to ask Lisa, maybe if you can help answer these questions, because I don't know that we can do that. Stephen asked a question about the Commission on Race and Equity and how well or how closely it represents the current or anticipated demographics of the city. I know you've been working on that commission, Lisa. Do you know the answer to Stephen's question?
Yeah, I would say it pretty well represents the community. There's a few members from the Old Town and the Hispanic community. Then we have representatives from the African American community as well as Asian population. So it does pretty well represent the current community demographics. Was there another question, Eric? I didn't catch another one.
Yeah, and there's a question about universal pre-K, and I don't know if you would know the answer to this question. If how the city is looking at defining universal pre-K. I know there's been discussions, and Christy pointed out that there has been discussions from staff about that policy. And do you know how they're defining universal pre-K? Is it just access and more opportunities for preschool, or is it actually looking at subsidized programs for those preschool age children?
They are looking at the subsidized programs as well. Yes.
Okay. So when it's listed as the outcome goal in the general plan materials, like the presentation, that outcome is looking at free or subsidized preschool for all children in South San Francisco.
Well, it would be based on ability to pay. So not everybody would have free pre-K. I believe it's based on your ability to pay for it, is how the funding is set up.
Okay, so that I just want to be clear, that's not actually universal pre-K. So when we put that on a general plan document, maybe changing it to something that says just that I just want to make sure it's accurate, so that nobody can come back later and say, hey, but you said this. And then we have to explain, just like, you know, we started as a city talking about universal basic income, and then everyone pointed out, actually what you're presenting isn't quite UBI. So then they changed it to guaranteed income. So if we want to change our words to say something like our outcome is, we hope, or we're trying to reach universal access, or not universal, we should just avoid universal, just access to affordable and quality pre-K for every child. That might be a little more accurate than using the term universal pre-K.
Makes sense. This is Billy. I was just going to say, I think the other thing with this is obviously we should start off with the aspirational language, but then kind of make a note of this is discussion point. So when we get to discussion with the public and the decision makers, making sure what is the intent, so we make sure that that final language is exactly what we want. And if it is something that would require more funding, that everyone's just aware of what that is. But so thanks for at least pointing that out, Christy.
Okay, yeah, just from what I've heard, I mean, it's been brought up a few times, but staff keeps using the term incorrectly, just like they were using UBI incorrectly. And so, you know, if we're going to decide as a CAC, you know, on the documents, we as a CAC understand it's the wrong term. So we don't have to put anything out from us, you know, having the wrong terminology on there.
And then there's one more question. Thanks, Christy and Billy and Lisa. There's one more question in the chat. It's from Stephen. And maybe, Stephen, you could actually maybe give us a little bit more context on it. You asked about digital literacy and accessibility. Can you maybe ask, can you ask that question?
Yeah, you know, in terms of what Diana was sharing in terms of equity, of course, being the big emphasis of tonight, you know, in terms of access to information and being able to understand, you know, information is housed digitally. What information do we have to those who are, quote unquote, digitally illiterate or not having access to the internet, things like that, which nowadays arguably could be considered, you know, a fundamental right. And so, you know, not everybody has access to that information. And I know there are members who, you know, use the library when they can because they, you know, for a variety of reasons. But what do we know about our population that may have that as a challenge? Or both points, literacy and accessibility, excuse me.
Diana, do you want to take a crack at that answer?
Sure. So I think in some instances, we are making some assumptions. So like we know that our unhoused populations may not have access to internet all of the time, which is why we were talking about having a drop-in center. We also know that the census gathers data on broadband internet, but we also know that that touches on some of the population, but we know that it's not just broadband internet anymore, that it's been expanded. So in some instances, we have tried to grab at proxies.
Okay, and actually that comes to mind in terms of even those who the aging population having digital, you know, being able to navigate that space. Because clearly there's a lot of information that's going to be impacting their health and the status and all that, and many of the things that we talked about. So yeah, I would love to have a bit better comprehension if we're really talking about equity. I think that's an important piece that will even get much more crucial to live daily lives.
Okay, and then this also reminds me from our like higher guiding principles. I think at one point we were talking about having internet access for everyone, like as a big like high dream and outcome. At this point, I'm not recalling if it made it to the final one, but it points to your point again directly. And if there would be any element where we would be thinking about these policies, it would make the most sense in the social equity element to be touching more on that. So thank you.
Welcome. And actually, may I squeeze in one more question, kind of one more thought? Do we have enough time to squeeze in a quick question?
I think so, yes.
Okay, thanks. Yeah, and this is a little bit closer to home, and I was just curious as well, because I noticed that you made some references, and boy, that's a lot of information, so I appreciate balancing and sharing it out with us. In terms of languages, there are 3 groups, I believe, and correct me if I'm missing it, emphasized in terms of you know, non-English languages, Spanish, Tagalog, and then Mandarin. And I'm just trying to understand how, maybe on 2 parts, and one a little bit closer to home, is how were those languages determined to be the primary top 3? And interestingly enough, with Mandarin, how did Mandarin come about, closer to home, Mandarin come about more than, or instead of perhaps Cantonese dialect?
So when we were doing our existing conditions, we took a look at census data, languages spoken at home, and those were the top 3. And I know that in some instances when we've been doing translations, when we first started this process, we were translating all of our documents, not just into Spanish, but also into Tagalog and Mandarin. And I know that one of our coworkers on staff emphasized, I think there was something about the distinction that in some instances, the translations seem to touch on Cantonese, and that in some instances, I think the way we were describing the translations of simplified Chinese, he emphasized that there was a distinction, and he wanted to make sure that we clarified. But our understanding is that based on the census data, we have been describing it as Mandarin, but we can take a closer look to see where Cantonese makes it on the list. And you can also, we're using, I think it was from 2019, so we're using census data from 2019, but since you're on the ground and this also represents your community, we'd want to know your perspective if there are more Cantonese speaking folks than Mandarin, and how that looks to you.
Yeah, I appreciate it. Wherever I can ask more. I don't want to consume the time, but yeah, there's a shift of more Mandarin speak Chinese population than Cantonese speaking, and which is different from the simplified versus traditional writing of characters. So that's a different type of thing. But more than happy to talk offline or in a different setting. But thanks for your responses.
Stephen, this is Billy. I think the larger kind of viewpoint for this is obviously the city needs to, we are a majority minority populations, and everything we've always done has just been in English. And so I think it's just showing that we obviously need to do more to reach out to those communities. This is kind of a first start to that, but I think it's going to be something that gets fine-tuned over time. Maybe we start out with a few, maybe over time we're able to get into more of them as some of the translation services get better and easier to use. But I think it speaks to the larger goal of how do we as a city get more input, and obviously kind of having the translation services is one high level way to do that.
Yeah, maybe one day we'll all wearing like South City made a universal translator, like in Star Trek, right?
Exactly.
Okay, well, thank you.
As far as data points, sorry for my barking dog. I had actually brought it up at my Parks and Rec Commission meeting, trying to see if we could get demographic data on our users for our programs. And I think that's something that could be done at different department levels. I mean, I'm not sure if it's legal to ask for demographic information when you're looking at like pulling up planning permit or, who the homeowner is or that kind of thing. But it's something we could look at for library services maybe. And Parks and Rec was going to look at seeing if it's possible to ask those sorts of questions, for childcare, preschool, and our programs, like rec programs. I know the school district also will have data, with graduation rates and things like that, but those are all equity data measures, that if we're talking about equity in the city, we probably want to take a look at that. I also noticed there wasn't any performance metric listed for the outcome of childcare for that bullet point that was listed in the document. And that's an easy one. A lot of nonprofit organizations actually have those data sets already of, how much we're lagging behind in childcare availability. I know they have that. I just don't know if they have it demographically at this point. But that's a performance metric we could add on.
Thank you. And I've done this presentation. This is the second time. And one of the things, as I was writing out these policies and goals and performance indicators and outcomes is that it connects to a lot of things. So I know I had a conversation with Eric where like my first instinct was to think about transportation. He's like, transportation is already being taken care of by someone else. And so I kept trying to do these things, and education with childcare was one of those things that I did touch on, but we ended up moving it into the parks and public facilities. And so I'm sorry that that's one of the things that I didn't remove from my presentation, but it's included in the park policy framework. But I will double check that they added a performance indicator.
Okay, that sounds great. I just wasn't sure because it's listed as a desired outcome.
No, yeah. No. Every time I was presenting it, and I'm always like, I knew I forgot to update one thing, and this is the second time I've done this presentation. But no, very, very good point. And then I will say that I believe Megan, who wrote the parks and public facilities framework, I think she also touched on engagement and tracking data to make sure like what programs and services folks are reaching out to and taking into consideration, like not just race, but also age and gender and like languages spoken, among other things. And so it's something that we are recommending, but it's a good idea to also think about it from a library's perspective.
Speaking to this kind of idea where we have like overlapping things going on, one of the policy frameworks that we looked at tonight was to protect vulnerable households from displacement. And in the policy framework information we were given about the challenges to that, it says that the sub areas of downtown, Sign Hill, El Camino, and Sunshine Gardens are at most risk for gentrification. But in the land use alternative that we approved and is going to be another part of this general plan, we've identified those areas as places for development. And then one of the challenges that's in the framework for this is that downtown is currently experiencing the most new residential development of any neighborhood. So in this framework, we're connecting the ideas of development and displacement and gentrification. And I know all these concepts are like very difficult and everyone has different definitions and they get kind of mushed together, but it seems that we should maybe define it somewhere, because if someone's reading this and then looks at a different section of the same general plan and says like, oh, this is a challenge, but then we're also advocating for it in a different section of the same plan, seems to be a real tension, which is the reality is that there is tension. But I think defining some of these terms and looking at what causes them would be a helpful way to alleviate some of that.
Actually, she's the one that asked me.
And I think that's a great point, Julianne. And I think when we think about housing, we're thinking about the P's. We're thinking about production, preservation, and protection all at the same time, right? And so you do have to think about where those overlap. I think this is to your point, is where those overlap. So if we are identifying areas in Lindenville, east of 101, and downtown that might be good opportunities for some housing development, in different ways, in different forms, we also have to recognize that has pressures in different ways on different populations who already live there, or you're sticking them in places that might have historical burdens of pollution that you might need to mitigate, right? So you have to think about both of those things kind of simultaneously. And it's complicated because it makes the equation much more difficult when you're talking about adding X number of housing units and trying to find new and different opportunities of where you can accommodate those across the community. And so a lot of times it is in places that either have like historically it's been in places that have marginalized populations, right? And you don't have those displacement protections for renters or business owners in some cases as well. So it's not just renters. And so you have to think about doing all of those pieces simultaneously. So if you think about that roadmap for housing, it does include all three of those pieces, and they move forward at the same time. And I think all of we're doing a housing element update as part of this process, but it's being done through an external partner called 21 Elements. It's region-wide. And so we're moving just a little bit, and we've been moving in front of them. And so they're actually now starting their work in earnest and they're starting these housing conversations now. And so what we're trying to do is pull together all this information that we've been hearing throughout the process to make sure that that goes into the housing element, so that it's kind of those pieces are well connected together. So we're all thinking about those three topics.
I had a comment to make about performance metrics in general. First, I want to say good job. I think you did a great job at identifying a lot of really complex information and the interplay between them. And I think that I actually made a comment of this nature when we kicked off this process, because I have a vision of myself saying it when we were all meeting in person. So it must have been a while ago. But I encourage this group and the Ramey team to think critically about performance metrics and ensure that we are setting the city up for success in being able to actually measure them and report on them and deliver on them. Performance metrics are something I think that sound really great, because people want accountability and people want to be able to track progress. But, with this one in particular, as I was reading through what had been identified, I mean, a lot of these things, each one of those is like a research project in and of itself. I mean, it can take a lot of work to collect and report on that data, particularly if you're looking at that many of them on an annual basis. I mean, that's like another staff position there. This is just like one or two elements of the plan. And also, some of these demographic trends, they take a while to change. You may not actually even necessarily, for better or for worse, be able to see a lot of change on an annual basis. So I'm not saying that I don't think that performance metrics are valuable. I think that they are, and they do serve to kind of hold the city and the community accountable and give you, kind of interim data points and things to work on, especially when you are looking at a general plan with such a long time horizon. It can be really informative, but I think that it's important to kind of set realistic expectations for what can actually be measured and tracked, and on what time frame. And maybe if there are some that we think are particularly important to or that really could show progress or inform decision making on an annual basis, to indicate that. And some of these things, maybe they only this is a 20+ year plan. I mean, maybe they only happen every 5 years or something. I mean, just something to keep in mind, especially once we have all of these draft policy frameworks completed and you are in a position to look at the draft plan as a whole and listing out all of those together, it's going to be a long list. So just something that I've been thinking about as we go through this, and particularly came to mind with this one in particular, the tension there between really wanting to see progress and wanting to track the data and acknowledging how difficult that's going to be.
Yeah, no, thank you. I think for this one, it was one of the harder ones. And our performance metrics, this was actually longer than this. I think Eric may remember, I feel like we had almost 100 indicators, and this process really helped us narrow it down, because we all wanted to see a whole bunch of things. And so we have about 4 to 5 per policy framework. And I think we have about 9 policy frameworks. Still a lot. If we cut it by half. And one of the other things that I've been thinking about is most of these data sets, we can get them statewide, like from CalEnviroScreen, which isn't going to be updated annually. So something that I've been starting to think about is how frequently each of these data sets is going to be tracked. And I know that some of these things are like life expectancy is not something that just the city alone will completely change. It includes a lot of different things, but we were trying to think of how to make sure, especially from the health in EJ and also equity perspective, that opportunity to try to look at whatever data we look at by race, just to have that separation, because in a lot of instances for other indicators, like I know for the transportation framework, they're talking a lot more about infrastructure. And so it's not about, it's going to impact people, but they're tracking the infrastructure. And so I was really thinking about this from like a people-based perspective, but you bring very good points. And I think that that's our next step. We're gonna take a look at all of these and take a look on, the hope is that they are pretty realistic because we added them onto the list and we thought about it, but taking into consideration how frequently they're updated and at the end of the day, how many indicators will the city be tracking and updating?
And just a quick point to add, you know, Sophie, you're totally right. I totally remember that comment. You did make that in the in-person days. What I would say is I think there's two pieces, right? There's outcome metrics, which is a lot of what you see in the policy framework. So we want to have, you know, no disparities across racial groups for, you know, life expectancy at birth. That's an outcome. There's a lot of things that the city and even the county public health department and others will be doing that's more programmatic, that they would probably be measuring as kind of these interim kind of performance metrics based around those kind of implementation steps that they're doing. And so it's a little bit of a balance between like the outcome metrics overall and those process-based metrics, which are like programmatic in nature. And so I think trying to find that right balance, like we're trying to strive to meet this is what our goal is, you know, we're taking these actions to get there. And you're right, like the general plan isn't necessarily going to, you know, get to that on its own. It's going to require all these external partners and all this other work that's being done state, regionally, locally to kind of to reduce those disparities overall.
Well,
it's a really important one.
And to that point, I mean, to the extent that you can take advantage of, you know, data reporting that other agencies or organizations are doing, like, great.
Anyone else? Anything that jumped out at you that you liked, something that you thought we were missing?
I'll jump in again. One thing that that struck me that I think I was happy to see, and I think we can probably get into a little bit more, you know, once we get into more detailed policies is, and we've touched on this before, I think in a couple of other meetings, is this whole issue of environmental health impacts associated with where we are locating the bulk of the new housing in the city. You know, near more industrial areas, closer to the freeway, you know, noise, traffic, air quality. They're real concerns. I mean, I think, you know, Diana, your personal example was a very poignant one. I think we just need to work very closely, particularly as we start to get into writing the zoning regs that go along with this for the housing, thinking really carefully about performance metrics and design, performance standards and development standards pertaining to residential areas, and not wanting to, you know, provide housing, but do it in a way that then ends up, you know, undermining public health or quality of life objectives.
Agreed. Yes.
One other comment that I just wanted to jump in and throw out there, and I apologize if this was already addressed earlier. I had to step away for a few moments. But something that I want to make sure stays on our radar is the idea of emphasizing ownership of housing, enabling people to start building that generational wealth that provides them with more opportunities if they need to move, or if they want to, if they need to have an emergency fund and they have, they can take out a loan against the house. I've seen that happen, things like that. It gives a lot more flexibility, even under less than ideal circumstances. And I don't remember, I feel like I have read studies in the past or seen at least headlines in passing on the internet. So take this with a grain of salt, but that, having that, owning your own home can enable better health outcomes because you have more control. So, just having that investment in the community, I think will go a long way toward equitability.
Diana, do you know?
Thank you.
Diana, do you
I'll
know
go for it.
If there's, does the HEART program, that first time homebuyers program, does it have data? Does it have data like separated out by city? That's a good question. What I'm trying to see is if, we already know there's some really great programs to help bridge, renters to become homeowners. And if there's some way the city can push for more programs like that for South San Francisco residents, to buy affordable homes within South San Francisco, I'm wondering if that's possible.
Yeah, I agree with that wholeheartedly, and also trying to push with our policies for a wider variety of types of housing. Things like townhomes and condos and things like that. That really does seem to be the way that this upcoming generation, my sister, for instance, are able to enter the housing market by, buying essentially a portion of a multifamily residence.
Yeah. I know. Go for it, Eric.
I was just going to say to Christy's question, I think it's one of the issues that, and one of the priorities from the Race and Social Equity Task Commission is actually that information distribution, right? So there's all these great resources, whether they're city or county or regional, that people don't even know really exist out there. And so I think one of their kind of main recommendations in an area of focus for that work is actually kind of building that infrastructure to kind of create that hub of information, and then figuring out how to best circulate that information in the community, that so people know that those programs exist out there. And that's not to say the city shouldn't continue to identify and supplement those types of programs, but certainly making sure people have access to and knowledge of those programs was one of those recommendations from that commission.
That's great. I'm glad to hear that. Thanks, Eric.
I think when we're talking about equity, the idea of home ownership is it gets a little complicated, because for home ownership to be something that you can accumulate wealth from means that you're extracting it from someone else. So if everyone's going to own a home, then you're not going to be able to extract wealth from it as a resource. So I think if we're talking about equity, I think the focus should really be on access to housing and housing as a right versus home ownership as a pathway for wealth accumulation. That's my thought.
That's true. Yeah, when I was talking about a pathway to home ownership, it's more because that way someone is putting their monthly payment to themselves, essentially, rather than, paying it to rent to someone else. But yeah, I know what you're saying. I totally
agree. And I understand what you're saying. I'm saying, like, into the framework of equity,
right?
It gets complicated.
I'm not familiar with that. How does one person, owning a home or a townhome or something like that, how does that take away from others more than, say, having it be the same unit be a rental?
Sure. So because it's not just one person, right? So the way that people that own their homes are able to extract wealth from it is that there is a balance between ownership and non-ownership. And so it's not just a one-person issue, it's a system that exists. And that's the reason why single-family home ownership is, especially in the Bay Area, a way to accumulate wealth. And so if we're talking about housing and equity, ownership complicates that because it advocates for a way to keep housing as a source for wealth versus a right to have shelter.
I could see it. I can certainly see both, but I don't see, I'm not quite following the connection between, you know, obviously housing as a right involves building the appropriate amount of housing and making sure that people can afford to live in that housing. But whether they rent it or own it, they're still getting shelter. So I'm, from an equity standpoint, enabling people to enter the housing market, you know, that system, I don't think that system is, it's not going to go away as far as I know, the system of, you know, having that sort of generational wealth accumulation. And I know that we did receive some very positive feedback when we shared the idea back months and months ago with members of, you know, more people in like Old Town and in the Latino community over there. They seem very enthusiastic with the idea of being able to enter the housing market more and take more ownership.
Sure, I'm not saying a pathway to homeownership is not a goal that people can have still. I'm saying in the focus of this element and equity, that if the goal is to get stable housing, that the emphasis should be on access to housing and shelter and not necessarily ownership and the connection to obtaining and securing equity.
Yeah, I see that. I think that what I'm talking about is, you know, it seems like, you know, if we were just talking about like specifically single family homes, you know, and that way, then I would agree with you wholeheartedly. Like we can't just keep building single family housing and trying to get people to be able to purchase that. At the same time, we need to also balance the risk of having these, you know, just, you know, massive property management companies that can, by just having rentals and putting all the focus on rentals without considering giving, you know, the individual ownership of, say, a condo in a large complex, for instance, we are risking expanding wealth inequality inadvertently, because we're putting the money from the benefits of owning that land. Someone's going to own it. We're putting the benefits onto a landlord and a specific large-scale property owner, as opposed to distributing that throughout the community.
Yeah, and I think also something that ties both of what you are all saying kind of ties back into what Jennifer first brought up, is thinking about that expansion of home ownership through the development of like cooperatives or community land trusts, because that system, although it hasn't been expanded very much, but it works at preserving affordability. And so there isn't that folks who buy into these cooperatives or own properties within these land trusts, they're not expecting for their equity on their home to increase by like 50% when like the housing market is increasing, and they're buying into it, understanding that it's about preserving affordability and having stability. And there is a bit of an increase, but it isn't as much. But you both bring very good points. Did you want to add anything else, Eric?
Nope. I was going to see if there were other comments on the framework or the outcomes or performance metrics that Diana presented.
Okay, well, I want to share the last few slides of the presentation because I want to make sure that this isn't the final opportunity you have to give feedback. So if you realize, oh, I forgot I needed to tell something to Diana, you can add them into all of these policy framework surveys. And so as I have mentioned, we have about 9 of them. And for this discussion, we touched on health and environmental justice, but also social equity. So if you go onto the website, this is similar to the feedback that we've gathered on the vision and guiding principles, where you have an interactive PDF that's about 5 to 8 pages, and you can directly add comments next to any of the images we have, any of the text we have. And so please, if you have any other ideas, please add them and share them with others. And so we have them open till the end of this week. One of the other things that we did also want to mention is that our next CAC meeting will be focusing on parks and recreation. And so we'll be deep diving similar to this and touching on all things parks and public facilities. And that will include policies on childcare and pre-K.
I was just going to say, we decided to keep the frameworks open till the end of the month. So there's a couple more weeks for folks to provide their comments. And so please, I'm going to just in a second drop that URL into the chat. Please share it with your friends, colleagues, neighbors, frenemies, coworkers. We'd love to hear additional comments from folks in the community.
Did you wrap everything up, Diana and Eric?
I think so.
Great.
Yeah, I think we're done.
All right. So now on the agenda, we have opportunity for staff comments. Tony, Billy, any staff comments to add? No? All right. Any staff comments? Any CAC member comments?